Hello. Today I have the distinct pleasure of walking you through a brief summary of my analysis of early hospital readmission in diabetic patients, highlighting important predictors and interaction effects that shape hospitalization outcomes. For the sake of time, this presentation is going to assume an audience that is familiar with the dataset and associated study. The objective of this project was to identify key predictors of early readmission in diabetic patients, controlling for possible effects of patient gender, age, race, admission source, discharge disposition, primary diagnosis, medical specialty of the admitting physician, and time spent in hospital. My approach was to use purposeful selection to build an appropriate logistic regression model with interaction effects to achieve optimal predictive accuracy. And ultimately, we are going to see that readmission risk is shaped by a combination of patient characteristics and hospital care factors. Six variables emerged as the strongest predictors of early readmission. Age was a particularly consistent factor. Patients 60 and older faced a significantly higher likelihood of readmission. Admission source also played a role, with physician-referred admissions showing increased rates of readmission. Discharge disposition was one of the strongest predictors, suggesting that patients discharged to locations other than home required additional post-hospital support. Beyond demographics and admission details, primary diagnosis played a major role. Patients with digestive, musculoskeletal, injury-related, or respiratory conditions faced heightened readmission risks, reinforcing the importance of tailored follow-up care for these groups. Similarly, admitting physician specialty influenced readmission rates. Patients under general practice, internal medicine, or unknown specialties experienced higher rehospitalization rates, possibly reflecting differences in inpatient management or continuity of care. Time spent in the hospital also very much mattered. While longer stays allow for potential patient stabilization, they can also signal more severe conditions or complex care needs, which may contribute to readmission risk, possibly. The refined model demonstrated that key predictors did not act in isolation. Several interaction effects, many interaction effects, improved predictive accuracy. Older patients admitted via physician referrals had the highest readmission rates. Longer hospital stays reduced readmission likelihood for patients not discharged to home, such as skilled nursing facilities, rehab, or hospice care. Genitourinary and musculoskeletal conditions showed the strongest link between hospitalization duration and readmission. Patients with missing or normal HbA1c test results had higher readmission rates, suggesting factors beyond glycemic control could possibly play a role here. These findings point to several areas for possible clinical intervention. Older adults and physician-referred admissions may benefit from stronger care coordination and post-discharge. The findings also suggest that simply monitoring HbA1c levels may not be enough to predict or prevent readmission. So diabetes care should probably account for broader health factors and individualized patient needs. In summary, this study reinforces that patient demographics, admission pathways, and inpatient care processes collectively influence readmission risk. By accounting for interaction effects, this refined model helps provide a more nuanced understanding of hospitalization patterns in diabetic patients. And finally, while this analysis provides insights into early readmission risk, it's important to acknowledge certain limitations. The scope of inference is constrained by factors such as reliance on retrospective data, meaning causality cannot be definitively established here. Other limitations, including missing data patterns and hospital documentation practices, are detailed further in the report. And finally, I want to thank you for your time, and especially thank you for your guidance throughout the semester. I really appreciate all the feedback and insights along the way, and I hope you have a great summer.